Hi, my name is Dory Abelman, and I'm from the Princess Margaret Cancer Centre in Toronto, Canada. I'm excited to tell you about a new test that we're developing to try reduce the need for bone marrow aspirates, which are very invasive and we don't want to get them very often. So what we do is we take blood from a normal blood draw, like from the arm, and from it we're able to get the myeloma tumor cells, like the genetic information from the myeloma tumor in the blood. And the reason that we can find it is because the myeloma, while it's in the bone marrow, the cells in the bone marrow are also changing. And when they change or they break, they release their genetic material, or DNA, which we can then find in the blood. So what we've been doing previously is we've been sequencing the DNA using this approach called whole genome sequencing. So it means it looks everywhere and out of all the places it could look in the DNA to try figure out what the mutations or the cancer changes in the DNA look like. And we were using this technology called whole genome sequencing, but to a medium depth. So we would look at each DNA molecule maybe 30 times to see if we can find the changes in the DNA that are maybe 1 out of 30 of the DNA molecules. But it was quite expensive. And there's this new technology that just came out, which is about 3 to 4 times less expensive than the old one. What I'm talking about here at this conference is how we were able to use this new test, which lets us look really, really deep at the DNA in the blood at the same price or less than the cost it used to be for us to only look a little bit into the blood. And doing that, we were able to find the majority of all of the bone marrow mutation changes in the blood. So we're hoping that that can help reduce the need to look into the bone marrow, for example, to try to find those changes. So interestingly, we found on average about 90% of all of the bone marrow changes. And we also found twice as many of the changes that are really important to doctors, like, for example, to help them decide if a patient needs a special drug or is of a different risk. Previously, also, we spoke about how we would use the mutations to track MRD. So another thing that we've been working on is getting all of the changes from the bone marrow at the beginning of someone's treatment or before they start treatment, and then looking for them in the blood over time. And if we find them, it gives us an idea of if the patient is minimal residual disease positive or negative. But using this technology, because we can find so many of the changes without even looking in the bone marrow, we're hoping that it can help even further reduce the need for bone marrow to get what we need to track minimal residual disease over time. So in summary, now a lot more patients can benefit from cell-free DNA testing. Previously, when we could only look maybe 30x, like a little bit medium into the DNA with the more expensive test, only about half of our patients had enough of the tumor DNA in the blood to really benefit from it. But now, because we can go so much deeper, at the same or lower cost, nearly all of our patients can benefit from this test. So this is still a research test that needs to go through some more experiments before we can release it to all patients. But we're hoping that in the future, patients will have another avenue to be able to detect what's going on with the myeloma tumor and help the doctors know what the best way to treat it is without needing to do so many painful and invasive bone marrow aspirates.